My name is Dr. Kei Sumida. I'm a nephrologist and currently a visiting scholar in the Division of Nephrology, Department of Medicine at the University of Tennessee Health Science Center. It is my great pleasure to discuss our upcoming publication in Mayo Clinic Proceedings entitled Association of Slopes of Estimated GFR with Post-ESRD Mortality in Advanced CKD Patients Transitioning to Dialysis. Each year, approximately 115,000 patients transition from advanced chronic kidney disease, or CKD, to end-stage renal disease, or ESRD, in the United States. Furthermore, patients who newly initiate dialysis treatment experience the highest mortality within the first few months after the transition to dialysis. So, it is important to identify modifiable risk factors and interventions in this vulnerable population. Several studies have demonstrated strong associations between the speed of kidney function loss, measured as the slopes of eGFR, and the risk of ESRD, cardiovascular disease, and mortality. However, little is known about the association of eGFR slopes in advanced CKD with cause-specific mortality following dialysis initiation. The aims of this study were to investigate the association of pre-dialysis eGFR slopes with all-cause, cardiovascular, and infection-related mortality following dialysis initiation in patients with advanced CKD transitioning to dialysis. We analyzed data from the transition of care in chronic kidney disease, or TCCKD cohort, consisting of 52,172 advanced CKD patients from VA medical centers who transitioned to dialysis from October 2007 through September 2011 and identified 18,874 patients with at least 2 outpatient eGFR measurements before dialysis initiation. eGFR slopes were calculated using all outpatient eGFR values and stratified into 4 categories. An eGFR slope less than -10 was defined as fast decline, -10 to -5 as moderate decline, -5 to 0 as slow decline, and 0 or more as increasing eGFR. We used Cox proportional hazards models to determine the association of eGFR slopes with outcomes during the post-ESRD period over a median follow-up of 2 years. Prior to transitioning to dialysis, 24%, 30%, and 42% of patients experienced fast, moderate, and slow eGFR decline respectively, and 4% of patients had increasing eGFR. Compared to patients with slow eGFR decline, those with moderate and fast eGFR decline had 6% and 11% higher risks of all-cause, and 11% and 13% higher risks of cardiovascular mortality, respectively, independent of comorbid conditions and other non-risk factors. In contrast, no significant associations were found between eGFR decline and infection-related mortality. However, increasing eGFR was only associated with 49% higher infection-related mortality. These findings highlight the importance of the change in eGFR on the risk for post-ESRD mortality and suggest that the eGFR slope is an additional predictor of mortality among end-stage dialysis patients. Finally, I would like to thank all of the co-authors, especially the principal investigators of this study, Dr. Csaba Kövesdi and Dr. Kamil Kalantazadeh, for their leadership in this study. Thank you very much for your interest in our study.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.